My name is Solomon Munyo. I'm the director of the IGAD Center for Pastoral Areas and Livestock Development. This is a specialized institution of IGAD that was established to complement member state initiatives in livestock development and development of semi-arid and arid areas of our region. The institution was initiated in 2011 and was signed off by member states in 2016. The emergency response that we've been mounting in Mandera, Doloado, Dolobe, and Gedo regions of our region, which is basically in Ethiopia, Somalia, and Kenya, was necessitated by the occurrence of the last drought, which was 2016-2017. The drought devastated livestock in the area, where we were implementing another project that's funded by the Swiss Development Cooperation, referred to as a IGAD FAO Partnership Program. The devastation of the livestock, the loss of ground cover, meant that the few surviving livestock needed to be supported with feed and salts and medication. So what we did was we were able to mobilize resources, both from the county and from the Swiss Development Corporation, and in collaboration with the county CECs of agriculture, who is also responsible for livestock and fisheries, and CEC Water, who is also responsible for environment, we were able to buy the mineral leaks and pellets, feed pellets, and these were distributed to the most needed homes. This response was quite a success, and it occurred at the same time as the NDMA, that's the National Drought Management Authority of the Kenya government, and the FAO of United Nations actually mounted their own response. So we had the three institutions respond to the drought, the effects of drought in that particular triangle. We also responded to a finding that the children in that area were suffering from vitamin A deficiency, and to make the availability of vitamin A more permanent, we introduced the yellow-fleshed potato vines. And the intention here was that those who are along the River Daua, who can irrigate, became the bulking sites. We were able to buy about 79,000 vines, and right now we have more than 20 farmers who have actually borrowed from the neighbors and have multiplied these vines. The idea is that the children and those most vulnerable who are suffering from vitamin A deficiency would actually eat the tubers. The tubers are very rich in vitamin A precursor.
It is intended to give these emaciated animals go for about 2 months. It's a feed for 2 months. That before the rains comes, they can be able to survive in those months. So, and each household is getting 15 kilograms. Each household is getting 15 kilograms of UMBB, which is range block cubes, and 114 kilograms of mineral salts.
Any other drought mitigation measures that the county government has put in place?
So far water tracking is going to go in by the county government. This is received from IGAD, and in the same line, there's a program called PDS, the Participatory Disease Surveillance, which is ongoing also. And in the same course, they are still treating animals.
Our initiative only, we were able to support about 700 households. But this is what we had targeted. What happened is that every time we had a distribution, these homesteads came with neighbors. So we eventually ended up with about 2,100 homesteads instead of the targeted 700. It was difficult to deny the neighbors this support, given that they were already in the areas of distribution. Now, the distribution was basically not by the members of staff of IGAD. We wanted to make sure that the involvement of the community and the involvement of the county is actually seen. So we took a backstage and we allowed the county authorities at sub-county level and county level to be the ones who were distributing the food. And also this also was important for us because we didn't want to go against any traditional norms of distribution, because you might end up breaching these traditional norms without knowing if you're from outside an area. The other element that we supported was training of the veterinarians and animal health experts at county level in what we call participatory disease search. Because we felt that if the county operatives have that capacity to be able to detect disease early, it means then they can support the communities to manage those diseases. Now, with the support from Swiss Development Corporation and in collaboration with FAO regional office, we were able to train some 13 veterinarians from all sub-counties of Mandera. A similar training was undertaken by FAO in Dolo Bay of Ethiopia, and a similar training will be undertaken by us in the Gedo region of Somalia.
Objective of this training was to enhance the disease surveillance for the veterinary department of the Mandera county government. Main roles of these officers from the county government was mainly to do with the prevention and control of diseases. In particular, they were involving in disease vaccinations, in disease surveillance and reporting, and also in regulating the animal movements within the county and outside the county. The training was very participatory. The methodology which we used in training the participants was we gave some presentations, short, brief presentations introducing the subjects, followed by questions and discussions. Then we had demonstrations in the classroom. We also had exercises which were done by the trainees. Group discussions were also held with the trainees. We also had role plays done with some roles given by the trainers. Finally, we had the trainees being divided into 3 groups, where they went to the field to practice the methodologies which they had learned in the classroom, and they practiced these methodologies with the communities within the Moyale County. The practicals were for 2 days, and they were taken to 2 various sites within the sub-counties in the county to practice with the communities, so that they will go and exactly do this with the communities in Mandera to collect data to prioritize animal diseases in their own county. After the training and after the teams had gone to the field, the trainers followed them when they were in the field, and when they had already finalized their exercise in the county, where they debriefed the trainers and the project team on the outcome of the field exercise they did in Mandera County.
The BDS we carried out from 16 locations in both sub-counties, Lafe and Mandera East. The exercise was very much interesting. The farmers have helped us in terms of diseases, the common diseases from the 5 livestock species: the cattle, the camel, goat, sheep, donkey, and chicken. They have listed us on the diseases on camel, the diseases on goat and sheep, which is common in the area. Also, they have shown us on how these diseases have impact on them in terms of meat, milk, and the meat on the area.
And we have been sent to the field to do the PDS activity. We have done very well, and the community whom we have involved and do the exercise with them are very appreciative. And we think the activity will going to help our community, our Mandera County people.
We have prioritized the certain diseases that were disturbing them for the last 2 years. The most important species they were keeping, and the prevalence of the diseases that were disturbing them for the last 2 years.
The main findings of the PDS were one, goats were identified as the most important species of the pastoralists, followed by camel, cattle, and sheep. And then for camel, the most important disease that was identified by the pastoralist is hemorrhagic septicemia, CBP for cattle, PPR for sheep and goats. We recommend that mass deworming and application of acaricide be done, because all the animals seem to be suffering from ecto and endoparasites. We also recommend that mass vaccination to be done for the priority diseases in the 4 species. We also recommend the carrying out of contemporary surveillance for the major diseases that were identified in this exercise.
We thank the donors, especially the IGAD, FAO, and Swiss Embassy, who are also our donors and help us on funding this project.
What we would suggest is that in future, we need to enhance the resilience of the people instead of having to respond to drought. Drought is not an emergency, really. We have lead time. We have 6 months warning, 6 months alert from the IGAD Climate Application and Prediction Center. With these 6 months, the counties and national governments and communities should be able to prepare adequately to respond. But for some strange reason, we always treat it like an emergency. We wait until animals are dying, and then we start running helter-skelter. This should actually change. We are not the only region that suffers from drought. North Africa is permanently in drought. It's the desert. Why aren't they always running after food aid? It's because they are prepared. Australia, even California in the US, South Africa has suffered from drought, protracted drought. But we don't see their people suffering and dying the way ours are. It simply means that they are better prepared than we are. And I really don't understand why, because it costs us more to respond than to actually prepare our own communities to respond. Instead of the support coming from outside, let it come from inside.